In a crisis or incident in an airport, like a plane crash for example, the airport emergency response teams scramble and head towards the crash site. They try to reach the crash site as soon as possible. Every second counts, especially when fire has broken out. As emergency vehicles arrive at the scene, the firefighters immediately secure the area and put out the fire. The hose team follows thereafter to make sure that the fire is completely out. As soon as the fire is contained and safe to approach, medics start to assess the scene and casualties. At the scene, proper assessment and appropriate management is done, checking the primary survey to make sure that there is no life-threatening injuries. Seeing a circumferential burn in the left lower extremity, they remove the wristwatch. They also place the patient on O2 inhalation via nasal cannula and start to dress the wounds.
I'm 14.
You're 14? Have any hypertension?
No, I don't think so.
No illness?
No.
As the patient is brought to the ambulance for transport, continuous care is done. While the medics contact the receiving hospital, they continue to coordinate and provide pre-arrival notification.
Roger, ma'am, kindly advise TMC that the patient has burn on the anterior left trunk.
The front desk receives the call and transfers it to the ER officer.
Connecting call from the SIAC. We have an incident and please transfer the call to the ER officer.
We have a call for ER, doctor.
Hello, good afternoon, Dr. Samson on the line. Alright, so we have a burn patient from the airport. So he's a pilot and his plane crashed. Okay, how's the patient right now?
The ER officer receives the endorsement and message that a burn victim is on his way to TMC, then prepares the ER and informs the necessary personnel.
Hello, yes. Ma'am Gail, this is of Emergency Department. We have an incoming burn patient. Yes, ma'am. And we need to ready our burn unit, ma'am. Guys, inform ko lang kayo, meron tayong incoming burn patient. So you must ready our trauma room.
As the ambulance approaches Medical City, you can see the medics continuously monitoring the victim and completing the patient chart.
Sir, what's your last name, sir?
The emergency room staff is already waiting for their arrival and greets them as they disembark from the ambulance. The patient is immediately brought to the trauma room. The medics endorse the patient properly, informing the ER officer of the latest status of the patient as observed.
You are in a plane crash. You're shivering right now.
ER officer assesses the patient and, as an additional precaution, places a cervical collar. He makes sure that there are no missed injuries that could be detrimental to the victim.
Right. Zach, you're still in pain, right? Okay, give me a number from 0 to 10. Let's score the pain that you're experiencing right now. And 10. 0, no pain, 10 was manageable to 10. Alright. Do you have any allergies to food or medication?
I don't think so.
Okay. Matt, neparidine 50 milligrams IV. So what we're going to do now is to provide with some pain relievers.
The ER officer and surgeon assess the patient simultaneously. An IV line is inserted and medications are ordered. The patient is also started on pain relievers in anticipation for the wound manipulation that will follow. Wounds are reassessed and the initial dressings removed carefully. An antimicrobial burn cream is applied afterwards. The patient is then admitted and transferred to the hydrotherapy room using the Meranti patient lift trolley, ensuring patient safety and comfort. After showering the patient, the nurses will remove the old dressing layer by layer until the wound is cleansed and new dressing is applied. All this time maintaining aseptic technique. This is done daily.